Next talk is from Pudis Michal, who's going to talk about the diagnostic impact of PET-CT in histiocytosis. Thanks, Pudis.
Good afternoon. My name is Michal Pudis, and I'm honored to be here since our institution is hosting this event this year. And I will be presenting our prospective comparative study on diagnostic impact of FDG PET MRI versus PET-CT in systemic histiocytosis. And this study was made possible through a close collaboration with nuclear medicine, internal medicine, and radiology. So just a little bit of background. We know that histiocytoses are rare systemic diseases which are characterized by abnormal accumulation of monocyte-derived histiocytes, and they have overlapping clinical manifestations which could cause a difficult diagnosis in this case. The three main subtypes would be Ehrheim-Chester disease, Langerhans histiocytosis, and Rosai-Dorfman disease. We know that the clinical standard, which helps with the diagnosis, staging, biopsy guidance, treatment response, and follow-up, would be PET-CT. But we know that PET-CT has some limitations, especially in the brain, heart, and kidneys or retroperitoneum. And in these cases, we propose that maybe PET MRI would be a better alternative, and that was the aim of our study, basically to demonstrate that PET MRI has better diagnostic performance over PET-CT. So our study design, it's a prospective comparative study that was done between 2022, that's when we acquired our PET MRI, until December last year. And we enrolled 15 patients in total, and 9 of them had ECD, Ehrheim-Chester, then 2 of them had Langerhans histiocytosis, 2 of them had Rosai-Dorfman, and we had 2 patients with mixed pathology. So most of our patients had Ehrheim-Chester. We did single FDG injection in all of these 15 patients, and after that we did sequential scanning. First we did PET-CT scan, you can see that on the picture, that's our PET-CT, and right after that we did PET MRI, that's also our PET MRI on the picture, and after that we did the reading or image interpretation, which was done by nuclear medicine physician and a radiologist. So during the reading we were trying to see the disease extent, anatomical definition, lesion detection, and metabolic uptake. Comparing these two techniques, PET-CT and PET MRI. And we correlated these findings with clinical presentation, laboratory markers, histopathology, and follow-up imaging in some cases. So the results out of these 15 patients, I have to say that 2 patients were in a complete remission, so they didn't have any findings, they were post-treatment. 13 patients did have findings, and in specifically there were 38 lesion regions affected. Not all of them were histiocytosis related. There were some incidental findings in 3 patients. There was a breast fibroadenoma, pancreas, and thyroid lesion. But histiocytosis related, they were mostly in the bones, lymph nodes, retroperitoneal space, cardiovascular, central nervous system, lungs, subcutaneous, orbital, and paranasal sinus. So first of all, we were trying to demonstrate that if there is a concordance between PET-CT and PET MRI, and they were quite concordant during staging, but there was 1 patient, so there was 93% of concordance between PET-CT and PET MRI, but in 1 patient, that's 7% in this case, there was a discordant finding on PET MRI. Well, there was an additional finding on PET MRI. I'll show you the case right now. So this is the patient on PET-CT. You can see that he has some inflammation in the left maxillary sinus, but we missed 1 lesion that was in the brainstem, which you can see on the PET MRI. And talking with the clinicians, patient had some ataxia and dysarthria. So we correlated this finding to his clinical symptoms, and yeah, effectively there was a lesion in the brainstem that wasn't detected on PET-CT. So the key diagnostic advantages for anatomical definition We agreed that in 60% of the patients there was better anatomical definition on PET MRI, especially in the central nervous system, cardiovascular system, and kidneys. But there was one patient that had Langerhans histiocytosis with lung lesions that were not that much visible as on PET CT. I will show you an example later. So lesion detection, we agreed that we found 33% more lesions by PET MRI, especially in the central nervous system, cardiovascular system, lymph nodes, and in the bone. But again, PET CT did better with lung lesions. And metabolic uptake, it was higher by PET MRI and lower by PET CT, but that could be due that our PET MRI, our PET is digital comparing to analog PET CT. So this is the patient with the lung lesion. On PET, you can see that there is some uptake in the lung. It's not like a clear image that we would like to see. I don't know if I can point. I don't know if you can see it much, but yeah, there is some uptake in the lung. So if you look at the CT scan, you can see the infiltrates, the septal thickening, and some ground glass opacities. On MRI, we were able to see some lesions, but you can see that it's like almost not visible at all. Then I'll show you another example in the central nervous system. You can see there is an uptake in the right cerebellum, which we were looking for a lesion on CT scan, and we didn't see any lesion there. But if we look at PET MRI, we can see clearly there is a lesion in the right cerebral area. But also we found another lesion. There was paracero lesions. You can see some bilateral uptake, and there were lesions right next to the cellar area. Here we have a cardiovascular system. We can see heart on this picture. There is an uptake in the right atrium on this picture. We were looking for a lesion on CT scan, and we couldn't see much on CT scan, so our diagnostic confidence was quite low, because sometimes there are some unspecific uptakes. Sorry. But if we have a look on PET MRI, we can see that there is a lesion in the right atrium, right here. And we were more confident about this uptake that it corresponded to a lesion. So there was a right atrial pseudotumor. There is another example on uptake around aorta. We're not sure if it's the wall around the aorta that has the uptake, but when we did the PET MRI, we could see that there is a soft tissue around aorta, and that's typical finding in Ehrheim-Chester disease. It's called coating of aorta. Also, there's another example of an uptake, which I first thought it's inside of the wall of aorta. That could be some plaque that was inflamed, and that's why there's an uptake. But if you have a closer look on PET MRI, we can see there is a soft tissue around aorta that has the uptake. So that's a typical finding in Ehrheim-Chester disease. So yeah, it's periaortic soft tissue coating. Then we have an example for the kidneys. On this picture, we are not able to delineate quite well the kidneys and see where is the perirenal area. But on PET MRI, we can delineate quite well the kidneys, and we can say that the patient has some perirenal infiltrates in this case. So we were wondering about the bones as well, if PET MRI is going to do well with the bone lesions, but it did quite well. We were able to detect them as well. They're sclerotic in Ehrheim-Chester disease, and yeah, you can see hypointensities on PET MRI with some uptake, which are the sclerotic lesions as well. So it was able to detect bone lesions as well. When talking about lesion delineation, you can see on this picture that there's a lymph node with some uptake, but it was much better delineated on PET MRI, which could serve for guidance for biopsies, for example. And also, PET MRI was able to detect more lymph nodes, affected lymph nodes, then PET-CT, as you can see on this picture there. There's a lymph node in the supraclavicular area and also in right axillary area. So for key results, when we compare PET-CT and PET-MRI, the soft tissue contrast was low by PET-CT, and it was excellent by PET-MRI. Lesion detection was reasonable by PET-CT, but PET-MRI did better. Radiation dose was higher by PET-CT. It was twice as higher than by PET-MRI. The acquisition time, it was faster by PET-CT and slower, but it was reasonable by PET-MRI. And there was a possibility by PET-MRI to do simultaneous acquisition. So we would acquire PET images with MRI images at the same time. So as conclusions, FDG PET-MRI offers significant advantages over PET-CT. It has better soft tissue resolution, improved lesion delineation, greater sensitivity, and reduces radiation exposure. This supports that PET-MRI should be integrated in diagnostic protocols, but further research is needed. And here I would like to mention that this had an impact on clinical decision making and treatment planning for these patients. So thank you for your attention.